Time starts now. First, we try to get a history of those around us. We look for the medical mechanism of the incident, injury. We look for previous medical history. Look for current medications or allergies. On our way to the athlete while putting on gloves, we look for environmental factors such as equipment, weather, and field hazards. We look for the body position to indicate to see if they have a spinal injury. We look for gross bleeding, severe bleeding, deformities, and we look at the skin color. And when we're at the athlete, we check for the level of consciousness. If they're like knocked out, we call 911, and then we begin the primary assessment without moving the helmet. We look for signs of life. We listen for their breath for 10 seconds while we get the AED. And when the AED is here, we get one rescue rate of 30 compressions per two breath. For chest compressions rate of 100 to 120 compressions per minute. Two rescue at the ratio of 30 compressions and two breath. We switch when the AED analyzes the rhythm while we call 911. And then for life-threatening bleeding, we check for severe bleeding, and then we control their severe bleeding by putting our fingers on the pressure points, on direct pressure on the pressure points. And we check for spinal injury by stabilizing their neck and head. If this assistant is present, we can put on a cervical collar, and then we also log roll the patient. And then if the EMS is here, we can spine board them. And then we look for shock. Symptoms of shock, we check for cool, clammy skin, weak and rapid pulse, pale skin. We look for shallow and rapid respirations, dilation of pupils, and their skin color is pale blue, it's a hemorrhage. If there's bright red, it's a heat stroke. And then we take the LOC. We take their vitals by checking the LOC, pulse. We check for the respiration rate. We check for blood pressure. We check for skin temperature, and then we look at the pupils reactive to light by doing the Perot test. And then begin the secondary assessment. We look for history, and we ask them, where does it hurt? Do you have pain in your neck? What happened? Do you hear, feel anything? Can you move your hands, wiggle your fingers? Can you move your feet, wiggle your toes? And do you feel any numbness? And then check for level of consciousness. We ask who, where, when, what were you doing? For the head-to-toe survey, we do a quick check for obviously signs of severe injuries. We look for edemas, deformities, look for normal to see abnormal. Starting with the head, we check for scalp, eyes, ears, mouth, and then we check for CSF in the blood. And then we check for cervical spine. Without a C-collar, we check for point tenderness, dislocation. And then for the chest and the lumbar spine, we check for point tenderness, dislocations. For the trunk, we check for clavicle, shoulders, chest. Movement on both sides have to be equal. Normal rise and fall. And then rib compression test, we check for crepitus or falls and abdominal movement. And then lastly, we check for abdominal. We check for the four quadrants with rigidity. For the right upper quadrant, we check for liver, gallbladder, colon, right kidney. LUQ, we check for stomach. We check for Kerr sign in the spleen, pancreas, their bowel, their left kidney. And then for the RLQ, we check for colon, appendix. We check for McBurney's point, the ureter. For women, we check for ovaries, fallopian tube, colon, and ureter. For females, we also check for LLQ. For females, we check for ovaries, bladder. RLQ for females, we check for uterus. And then we move on to the pelvis to do the compression test. We check for fractures. If they're if their legs are longer, it's a fracture. And if the dislocation is shorter and rotated inwards. For legs and feet, we check for fractures or bleeding. We check dorsal pedal, posterior tibial. We check for motor response by doing the plantar dorsiflexi feet. And if they're unconscious, we scratch their foot to get the Babinowski's, whatever, something response. But so their great toe exterior now displayed. That means their upper motor neuron has a lesion, which signifies brain damage. Then we check their sensation. If they're unconscious, you scratch their foot, the arch, the inside of their foot. Then we check the arm and hands for fractures and bleeding. We check for the radial pulse. We check for the motor response by squeezing their fingers. And for sensation, if they're unconscious, we scratch the insides of each hand. And then lastly, we recheck vitals once again, looking for LOC, pulse, respiration, blood temperature, skin temperature, and appearance. And then we check for pupils once again with Perot test. This concludes primary, secondary survey. I have a better understanding of the specific injury. I'm going to maintain the airway, continue to perform rescue, breathing, until relieved by qualified medical personnel. I will control fractures, bleeding, treatment for shock, check their vital signs every 5 minutes, and monitor their level of consciousness constantly. And when I'm finished, I will refer my patient to a physician as needed. And